Hi guys, so it is currently 3:52 a.m. and I can't sleep, so I decided to record a video, but I also don't know if I'll post it. It's just some reflections that I've done over the past few days. So for some context, I'm currently in year 2 of medical school, and then I'll be having my finals in about 1 month, and we were going through our last block because we learn in blocks. Like each block is a different system. So there's gastro is one block, oncology is one block, respi is one block, cardio is one block, and I'm in my last block currently. And I don't know, it's just maybe it's because the exam is in 1 month, so I got super overwhelmed. But also, I was so disappointed in myself 1 day ago. I'm not sure if I'm still disappointed, but sometimes 1 day can change a lot of things. Okay, so what happened was I was in clinicals, and after every clinical session, right, I feel motivated usually to learn even before the clinical session. I feel motivated to learn from the doctor and also to see patients, but also coming with that is the feeling of being intimidated, because very frankly I'm still very troubled by being perceived, and also just I feel I'm not a great student, and that's what this video is about. It's about not being a splendid medical student. I feel when, of course, in medical school, we all want to do well. Beyond the grades, everyone wants to come up with a differential diagnosis when you're given a case, and then be able to explain why you have to justify that diagnosis and why you chose that, and be able to know all the tests that you would do and understand everything that's being taught. But sometimes it's very disappointing when you discover that maybe I'm just not good enough for this. Sometimes this thought just comes up. I know about this theory called you observe your thoughts passing by because they aren't you. It's you just let them pass through your mind. But sometimes when you're in the moment, it's so hard to do it because of self-doubt, and also maybe in the moment when I can't answer a question, there'll be an adrenaline rush and I feel super embarrassed. I feel beyond the embarrassment of it, it's just this internal humiliation that I feel, especially during clinicals, because the patients are there, and then I know that I'm not a doctor yet, but also it makes me feel very irresponsible for not being competent. And it's been tough coming to terms with that as well. I know that we'll never feel prepared at any stage, but sometimes I also just think oh, I feel I'm not up to the standard. And maybe that's true that I'm not up to the standard. If we look at it in a very rational, logical way, then the only course of action is just to improve your skills, which is also what I'm trying to do. But it's just a cycle. It's I know I'm not enough, and then I go and read up, and then okay, maybe I feel I've improved, and then another situation will come out where I feel I'm not enough. So I guess in medicine, because it's lifelong learning, or maybe in any other profession as well, you will never be splendid unless you are one of the people, maybe the top 10th percentile, actually still a lot who put in the work and become splendid medical students. But what happens when you're just mediocre? That's what I am trying to discover. So I know this is a bit long-winded, but after some pondering, yeah, I just decided to read up on the different differentials that I can have on off the top of my mind, and like try to answer the questions that I couldn't answer. And also like I have this thing right where I cannot think under pressure unless I am very very clear-minded, which is not too good of a trait for a doctor, you know. But I also know that this is something that you can train over time, because sometimes when I'm taking a history, I also feel like I'm too worried about what is the next question that I should ask and what's the structure, that I lose track of like the whole complaint. Yeah, but this also comes with practice. So yeah, and I think I still have yet to find like a very suitable learning system for me to retain all the information. And it was actually very like it was like very overwhelming also, because I watched these case presentation videos on YouTube, and then I just try to like think about the different differentials that I can come up with the chief complaint. And then okay, these were like prompts given off from like ChatGPT or some YouTube videos, but I realized when you integrate all the systems together, then I cannot really like think clearly, because maybe all along we've been used to doing history taking. Maybe patient has colorectal cancer, and then we just take a history about this, or like the patient present with frothy urine, and then because it's the renal block, so we will just focus on renal symptoms. But I never think about what this chief complaint can mean, like if it's caused by any other systems. I know that I'll learn this either ways, like in third year, because we have to go through internal med, and internal med has so many things, and also for other rotations as well. But that was one of the things that I've been very worried about these past few days. Yeah. And okay, going back to the topic, I feel like I would always dream about being the distinction student, about like excelling in my studies and not being afraid when the doctor asks me to answer questions. But maybe I have to accept that that is who I am, and the strength comes from doing it regardless of embarrassing yourself, because if you embarrass yourself, then you're more likely to learn also. So I guess the thing is just to put the attention away from embarrassing yourself and put it into solving the problem, aka fixing your misunderstandings or like broadening your knowledge. Yeah. I feel like once I put this down, like once I actually can make this mindset shift, then maybe I'll have a better time, especially in clinical years. It's also one of my concerns, that is like, if I'm so bad at improvising and thinking off the top of my head, then how am I gonna, you know, score in clinicals? Yeah, because if I'm only like okay at answering paper-based questions, then what kind of doctor am I? Because doctors, they don't answer MCQs. They actually have to like diagnose. They have to think on the spot. Hi. So yeah, I'm like excited for the future because I am interested in this. It's just that yeah, I got to get over these fears of mine. Peace. Also guys, I cut my hair. Hee. Yay. Okay, I have nothing else to say. Bye guys. I hope if any of y'all are facing these problems, know that you're not alone, and let's continue practicing our our tolerance to embarrassment. Okay, it's not embarrassing lah also lah, because everyone makes mistakes, right? It's like, as long as just being a medical student is the time to learn. And when you become like a houseman, you can't, okay, you still learn but then like, that is responsibility already. So now, we can make all the mistakes we want, but don't cause harm to the patient lah, of course. Like, yeah, I guess it's part of the package. We just continue being motivated, or try keeping yourself motivated. Yes. Yeah. Okay, peace. Bye guys.